over to the next.
Yes, we will go to PPE and Dr. Leandro Pecchia.
Thank you, Tom. Thank you, Adriana, for this introduction. I will not take long. I want to just remind to the attendees what has been covered in the webinar dedicated to PPE, which happened at the 8th of May, if I'm correct. And basically what we did was we started setting the floor, and Busola did a very nice introduction with Tom. And then Yingling Lin, which has been an intern and consultant for a long time for WHO, gave a very nice overview of what do we mean by PPE, what is the difference between PPE mask and the medical device mask, what are the relevant standards that people should consider, what should we look after in case we consider to buy or not a PPE in our hospital, and what manufacturers should consider in terms of standard, and what are the priority tests that probably should be prioritized at this moment of crisis when we need fast access to the market, but still quality, which is an important issue. And then Adriana gave a very comprehensive overview of the World Health Organization perspective on PPE beyond the COVID crisis, because obviously their expertise started now many years ago, probably reinforced by the outbreak of Ebola, as I can remember as last dramatic event, which forced the attention towards protective equipment. And then we had a very nice presentation from Nigeria, Dr. Popola and Professor Akinloye, which gave a perspective of a representative sub-Saharan country, Nigeria, and what are their main priorities now facing this COVID crisis when it comes to protective equipment. And then we opened the discussion to the floor, and we got a lot of questions. Probably the most recurrent one was about what should we do? Can we reclean? Can we sterilize the mask, and those kind of questions, which the fact that we are giving a webinar doesn't mean we have all the answers, but we made an effort to collect as much as possible answers, and Busola did a great job in making a resume of this webinar, which will be circulated soon if it is not yet already available. I will not need to enter more in details because this webinar is freely online, and you can go there and review the part that you may need and you may have more interest in. And then we closed the discussion commenting on the fact that international standards are good, they ensure quality, but to some extent they have revealed some frailty now in time of crisis, and probably every time when we think about lower income countries, because those standards have been going in a direction which were as much comprehensive as possible, covering all the possible working place, including, I don't know, heavy metal and stuff like that. Which are probably not relevant for hospitals. So narrowing down those international standards, what we really need now in clinical environment, it's really important, and it's legally viable, because in this moment, the European Commission granted the opportunity to follow WHO guidelines instead of traditional standards when we think to manufacture and put on the market novel PPE and some medical devices. Okay, I will take no more time, but just invite you to review the material which has been put online on the YouTube channel of the IFMBE, and the one that will be circulated soon in terms of resume and the answers to the questions we collected. Thank you.
Thank you, Leandro. Now we're going to go to a poll about this topic, and Caleroy is going to make that available to you. And at the bottom of your tabs, I believe on your Zoom, you can see the polls tab, and go on and go to that now. We're going to take a few seconds of silence for you to consider and act on the poll, including the panelists. Thanks. So check out the poll, and we're going to see your results, and we're going to discuss those results as our approach to discussion of this particular topic this morning. So haven't seen you taking the poll yet, so go ahead, and you'll see the polls right next to the Q&A at the bottom of your tab. And okay, we've started to see the votes, so go ahead and do that now, everybody, please. So the questions for those that are having any trouble with that, and the numbers are rising, thank you. Do you find the WCED Town Hall webinar information on PPE. Could you find it? And of the following subjects, the biggest challenge to you are, and you can select up to 4, safe use, specifications, installation, and so on. Do you or your organization have technical information or procedures on PPE that can be publicly shared with WHO and CED community, and check those? So 3 questions. Thanks, and we're getting some good voting here. So Leandro, as we get to maybe 30% or more of the group online, which we're at right now, you can begin a discussion on that if you will.
So do we have time for questions? And please, I invite all the attendees to write whatever question you may have in this moment or observation in the question and answer box. We will do our best to answer those questions live, but if we will not have time, we will continue offline and the answers will be published soon. So if you look down to your screen, you should have a question and answer cloud box where you can answer those questions. Adriana, I have a question for you. You mentioned during the webinar that a novel guideline from the World Health Organization was going to be published soon about PPE. You mentioned this also before the working group. Is this new guideline being made available yet? Do you want to say something on that?
It is not available yet. Sorry, it's not available yet. It will be any time. We thought it was going to be published today. It's not yet, but that contains the different uses of the mask from community and then for healthcare workers. And that will be the update of the rational use of PPE that has been now the most downloaded document in WHO, actually, that one. No, so this will supersede that one, but still not available. As soon as it is available, maybe I'll send the link to CED so that they can publish, or we can send it to all. But if I may say, we wanted also to see if you all agree that we use your emails to send you the newsletter, the WHO newsletter, and then we can add it there. Over.
Fantastic. Okay, Tom, in the sake of time, I would go on if you agree. And meanwhile, if we get questions, probably we can answer to those questions later.
Sure, but I'm going to let the panelists just weigh in just for a moment. We see from the poll, and about half of the group has responded on it, and yeah, they're finding the webinars reasonably useful. Getting on to the next challenges, safe use is 60% of the answers around safe use. So Adriana, I'm going to ask you just to mention maybe things about how folks can deal with safe use. And another thing that's a little bit further behind, but we haven't talked about a lot, is decontamination. And I know we're going to say more about that probably in a June webinar. But Adriana, in response to what you're seeing here on these challenges?
Yeah, is there any way that you share your screen? Because we cannot see, at least I cannot see the responses for the polls. I don't know.
I don't know, Calroy, if you can share that with others, or.
They will be shown and shared to everybody when the poll ends.
All right, I'm going to go on and
okay.
show mine then.
Meanwhile, we have the question from the poll, which is about homemade protective equipment. I think this was another thing which came across our last meeting, during our last meeting. And my personal opinion is that obviously if you have nothing better and you are a civil person, I mean, person taking care of your health, probably this is better than nothing. But our focus on quality, regulatory framework, safety was for workers. So we need to raise the attention about quality, which test is relevant, because we need to save and protect our NHS workers. And this was where the discussion was going on mainly. I don't know if Adriana, you want to add something more in that?
Okay. Thank you, Leandro. Yes, the guidance from regulators is basically on medical masks and surgical masks. I mean, surgical masks, medical N95, and so on. For homemade use, there was nothing. But because a lot of the population has been asking about it now, even regulatory authorities are giving some guidance on that. So that is something that we wanted to discuss, and that will be discussed by the experts on PPE, so that we can try to find out what will be needed for local manufacturing and what are the different specialties. But the new guidance document actually contains that part about if you use cotton or other material, and so what are the layers, etc. So yeah, that would be good. Okay. Tom, may I comment something important?
Please.
For the ones that voted in the poll, I think to please confirm that the poll that you're asking, that you will be receiving, are specific for the specific topics. So for example, installation or maintenance does not apply to PPE. So I just want to raise that issue, because you will be receiving a poll, and maybe we didn't explain that very well, but you will be receiving a poll like this for every topic. So it is important that your responses for the poll just say it every topic. And in case you say you have material that WHO can use, we didn't have a space here to put it, but just send it through the question and answers saying, I have a material, no? So that then we know who to contact later. Thank you.